Community approaches to wellness, empowering individuals and promoting equity. This session will emphasize the importance of community participation and social support in achieving good health and reducing inequality. Participants will explore community-based operations, grassroots initiatives, and the role of social factors to promote wellness communities. Ladies and gentlemen, to moderate this session, please give a warm welcome to our moderators, Assistant Professor Dr. Nathapan Chinlamprasert. Onto the stage, Dean of Faculty of Nursing at St. Louis College. Please give her a warm welcome. I will now hand off the stage to you.
Good afternoon, everyone. Our respectful Dr. Kiengsak Charanwongsak, the chairman of the Nation Building Institute, and all the honorable speaker. This is my honor and pleasure to be the moderator on for this session. First of all, I would like to give you the brief about the session 3, about the community approach to wellness, empowering individual and promoting equity. So this session will be very important in this era. Especially, we would like to highlight the importance of the community engagement and social support in achieving wellness and reducing disparity. It explores community-based intervention and grassroots initiative, and the role of the social determinants of health in achieving wellness outcomes. This session we will have the very important questions to be discussed by the speaker. So we have altogether 5 speakers today, and the question that we would like to discuss includes we would like to know how can community engagement and grassroots initiative contribute to improving wellness outcome and reducing disparity. And the second question is, what are some successful examples of community-based intervention that have addressed wellness disparity in adverse population? And how can social support network and community resources be leveraged to promote wellness and resilience? Importantly, we also would like to know what role do social determinants of health, such as education, employment, and housing play in community wellness, and how can they be addressed in this topic? What are the challenges and opportunities in building sustainable and inclusive community wellness program, and how can they be overcome? So now this is a very important time that I would like to introduce our 4 speakers. And the first speaker that I would like to introduce today is Dr. Sompong Chayopanon. He is the chairman of the Advisory Committee, Office of Advisory Committee, Department of Health, Ministry of Public Health. So he will share with us via the Zoom. So the floor is yours, Dr. Sompong. So while waiting, okay, ได้ค่ะ So the second speaker will be Dr. Cynthia Mong Lamen Magsaysay Award, who is the award recipient, who is the founder of Metal Clinic at Tax Province. Dr. Cynthia, please proceed to the stage. And the next speaker will be Professor Waratha Mongkol Sirpsakul from the Faculty of Humanity and Social Science, Thaksin University, and Mr. Timothy Amen Lasmitiwan, the Board of Directors of and Chief Executive Officer of Thonburi Wellbeing Company Limited. Please give a big applause to all of them. Oh, and then the last but not least, the very important person is His Excellency, Mr. Kim Tines Lindsay Kim Ho, the Ambassador of Kenya to Thailand. Please. So now I would like to invite the first speaker, Dr. Sompong, please. Dr. Sompong, okay, the floor is yours.
Thank you for everyone and Dr. Kiansak, the organizer of today. And good afternoon to participants. This session, I would like to show the slide. And go on with my slide, please. Slide, please. Okay. On this session, we would like to talk about quality approach to wellness. This session, we would like to talk about it, empowering the individual for our health approach to be eventually well-being. Next slide, please. This will begin with the global level. This coming to July, we will have the health 28 some to strengthen the means of implementation and revitalize the global partnership for sustained development. Next slide, please. Next slide, please. Okay. At our national level, we have the public health benefit under the national health scheme, or we call universal coverage health. Through our responsible sector as a health sector, social community, and with the family engagement, we could approach to the grassroots overall area of our country. And the public-private sector collaboration is the initial requirement. Our example of success, we could show about the measure against COVID transmission is one of the successful story that we can control the pandemic of the COVID infection. Next slide, please. We all in our country we have many health insurance schemes, such as the universal coverage national health scheme as previous told. The second, government or state officer right. The third, social security health insurance, foreign social security, including non-Thai resident health insurance. Next slide, please. Under many schemes responsible for the people who live in Thailand, we have a Thai family health care included to the tertiary care system. We have this system been provided to communities in about 20 years before. And more than that, we have the national health scheme since first, and we can approach the community by our health personnel and village health volunteer, and we can also cover the working place under the health volunteer in the working place and health personnel. This is the example of the success story of the health system in Thailand that we run more than 20 years in the name of the universal coverage in health scheme. But beyond that, we have in Thai, we should looking back that we could produce the the pox vaccine more than about 19 years before at the highest cost. Then this slide will show about that how can social support network and community resource be leveraged to promote wellness and resilience. If you look to the goal of and present about a few years ago, we have the development of quality of life scheme in community that we set the goal at to be healthy people, healthy environment, living place, prosperous economic and social community wellness. We conduct this development of quality of life scheme to the government sector, social and private sector, included local administrative, working as the network in community to support people well-being, direct to the county people. Next slide, please. The main issue in health that it will emphasize to be leveraged is nutrition, physical activity, sleep health, stress management, and relationship, substance avoidance, included healthy environment. Next slide, please. Next slide, we will talk about what role do social determinants of health, such as education, employment, housing, play in community wellness, and how can be addressed. According to the World Health Organization, the World Health Organization talk about the social determinant important is more than healthcare or lifestyle choice that it will influence the health and it can influence health in equity in positive and negative way. Next slide, please. And what do we do to concern the social determinant of health? Let me look into the example of the social determinant of health. We look into the income, social protection, the education, and address the unemployment and job insecurity, working life condition, work insecurity address, and housing, basic amenity, and the environment, early childhood development, social inclusion, and non-discrimination, structural conflict, access to affordable health service of decent quality. This is the social determinant that our government sector will be collaborate to address it under the collaborate of the public-private sector. Let me look into the social determinant of health important. We can see that 80% of non-communicable disease related deaths occur in the low and middle income countries. This may tell us that the income, the economic status, the social demographic factor affect the disease control that we could address the economic of our people should raise their income in our countries. Next slide, please. So let me look into the main opportunity building sustainable and inclusive quality wellness. We look into the health literacy and practice. The second, economic literacy and practice. Go on to the social and environment literacy and practice. And the final one, the peaceful living literacy and practice. At present day, there's many battlefield that may affect the living of all the people in our world. And I will go on to the health sector session the opportunity in building sustainable and inclusive quality wellness program. Let me look into the health issue. We depend on the national health policy to support health lifestyle of the people, healthy environment to promote economic growth directly to grassroots and all sector collaboration and support must be the first one to begin all the program. And the third is the healthy lifestyle in the national health scheme to be provided in coverage to all people under the social funding, government sector budget, and all sectors support, including the well-trained personnel and volunteer to help our people in the community. Next slide, please. What are the challenges and opportunity in building sustainable inclusive? Let me look into the health issue. We begin with the health literacy and lifestyle change. That is one of few key issues that will bring us to be achieved under the health behavior modification by lifestyle change. Next slide, please. Yeah. That all that we have done in our country to bring the healthy life to all the people in our country, included the non-Thai resident who living, working in Thailand. Thank you.
Thank you very much for your resourceful presentation. So you already give so many data about the policy of the country and also the example of the initiative that have done, including the health insurance and everything that the committee will receive in order to promote wellness. So I believe that the four will have the question right now because of the time constraint. So I would like to invite you to stay with us so that by the end of the session, we might have some question for you. But anyway, I just would like to ask the audience that, do you have just one question now? Not yet? Okay, so please, thank you very much, Dr. Sompong. So please give one more approach for him. Okay, may I introduce the next speaker, Dr. Sinthian Mong Laman Magsaysay Award recipient and the father of Metao Clinic at Dax Province. So your presentation will be very interesting also, include about the Myanmar-Thailand border. So now I would like to invite Dr. Sinthian, please.
Good afternoon, everybody. Thank you for having this opportunity to give a presentation about my work and while we are working with the migrant and displaced community on the Thailand-Myanmar border. I am a founder and director of Mental Clinic working with displaced community. Next slide, please. Displaced community. So let me start with the background of the presentation outline focus on the four issues. One is the context as we are working with the displaced and migrant community, and then I will introduce my organization, Mental Clinic, and also how we've been or our community building the resilient community to promote equity and what is the lesson learned over the past experience. So starting with the context here, as you may are aware that Burma has been under the military and political oppression and going on and on since 1962, and the economic mismanagement and disparity across the country One thing I would like to highlight, and one of the striking indicator is Burma has one of the highest maternal death in the Asia country, and we in the 2015 census we have 282 death per 100,000 life, but this is like almost 3 times higher than in Thailand. But in the border area where the ethnic conflicts going on, they are 2.5 times higher. So this is a really high maternal death rate. It can make difficult situation for mother and women who are living in the very difficult circumstances. And in the February 1st, 2021, the military coup, there has been increasing humanitarian crisis and health crisis. So the prevalence of depression and anxiety increased from 18% before the coup to 61% in 2021, and that all the supply chain and the vaccination program be interrupted. So we have the second highest percentage of children with zero-dose immunization globally. This exceeds 50%. So we share Thailand and Myanmar border. We share almost 2,000 kilometers, and there is always some cross-border movement when the local ethnic people and finding the education or health care opportunity, as well as the economic, the exchange of goods. And we also have different ethnic community living and staying on the border area. Conflicts going on, and in 1986, the first refugee influx into Thailand. So there are almost 900,000 refugees living in the Mae Hong Son, Tak, and Sangkhlapuri area. But some of those who are not living in the refugee camp, they stay outside the camp or they are internally displaced. So we can see that almost 600,000 people are stateless. And since the coup in Myanmar, almost 1.3 million people fled to neighboring countries, and the highest number is in Thailand side. And 2.6 million people become internally displaced. There are many housing or villages being destroyed. And the human rights violation against civilian restriction of the international humanitarian assistance is making more difficult for people living in this conflict or displaced community. So since the military coup, more than 300 health facilities have been damaged, and 900 medical workers are arrested, and 600 public health service medical doctors displaced from the job. So currently, we estimate that in the Tak border, there are almost 400,000 displaced people and do not have legal documents or health access. There are some of those who live in Thailand for many, many years, and they have some opportunity to access education and healthcare. But actually, especially after the military coup, there is a huge influx of refugees who do not have access to healthcare, education, and they have the different barrier to access services. And we also see that some of those are children, women, many of them women, children, they are vulnerable to be abused like sexual exploitation. So let me introduce Mad Clinic. I'm founder and director of Mad Clinic, and I myself fled to Thailand in 1988 when the military coup in Myanmar. And we established a health center for displaced people. And during those times, also we have high prevalence of malaria on the border. So the major problem of health is the mental health, malaria, and war injury. So 35 years, we've been existed in Thailand, 35 years, and our program been expanded. And we provide comprehensive service, reproductive health, maternal child care, immunization, and we also have community outreach especially focusing on the women and girl for like a family planning or comprehensive sexual education. And there are many refugees, migrants who are living inside Myanmar side. So to access like a life-saving emergency service or advanced level care to refer to local Thai government hospital along the border. So we are supporting and facilitating for referral services. And we also train health workers. More than 4,000 health workers been trained as a medic, nurse aide, or community midwife to provide healthcare service for marginalized people or internally displaced people along the Thailand-Burma border. And there are many community initiative, community learning center being set up. So currently 64 migrant learning center being set up and hosting almost 20,000 children, providing education for migrant children, and all the organization working together on like child protection or women protection policies, child safeguard policy to implement in their program. So these are just brief information on what are the services we provide and how many cases. So in 2023, almost 45,000 people access to healthcare at the clinic, and we have to provide like a safe delivery for children. So almost 14,000 children, 1,400 children being safely delivered, and we can provide access to the like official birth certificate. So these are the school providing like starting from kindergarten to middle school level. So the teacher also receive child safeguarding policy and implementing the child safeguarding policy in the school. So briefly explain how we are working with the migrants and displaced population. So we always have to manage the like a public health emergency. Like the first thing in 2000, 2001, we facing the like COVID. So COVID emergency, public emergency, and in the 2021 when the military coup. So we have to respond to the needs of the community, and that there are two crises. So we have to address not only for the immediate terms, also the long term, especially along the Thailand-Burma border. Vaccination rate is very low. People movement, a lot of people moving back and forth. So we have to advance more on the disease surveillance or communicable disease control in the community. And because of the coup or because of the complexity, the humanitarian workers or the patient themselves or the community themselves suffer from mental health. So we have to set up like a mental health center, and also have to start enhancing our capacity to improve access through the cross-border supply chain. And among the displaced people are doctor, nurses from Myanmar. So we also have to make sure that these skilled health professionals who are living, working on the border area being safe and they can work in the appropriate job. So to build a resilient community and promoting the equality, our main focus is workforce development. As I mentioned that many young people displaced from Myanmar become migrant workers or internal displaced, and they lost opportunity for their career pathway or professional development. So we focus a lot on the human resource development or workforce development on both like social worker or teacher or health worker. So together with our community partner organization, we have to enhance to train more community volunteer or midwife to reach to more vulnerable population. And since we work with a diverse population, we have to be very mindful about the diversity, inclusiveness, and quality and safety of the care, especially for the people who are moving from Myanmar who do not have access to the legal documents. So the security and protection of these people are very important, as well as to be able to access affordable healthcare service. We always have to use the data, how many people crossing the border from Burma using our service and what are the legal status. So these are the things we have to be more proactive. And to respond to that, all the organizations working on the border have to restructure and reorientate our work. And then we have to enhance our occupational health and safety, health information system, as well as we have to build a partnership in different sectors to make sure that our resources being shared and we communicate clearly and we establish trust and understanding among ourselves. So what lesson we learn is working with the displaced, marginalized people. It is very important that the community or the refugee themselves, they are actively engaged and participate, and we have to listen and get feedback from them and learn from the community and identify the priorities. At the same time, we have to, all the organizations working together, we have to adhere to the humanitarian principle, like non-discrimination, because regardless of the ethnicity or status or gender or age group, we have to work together on getting more equal opportunity for accessing healthcare education, and mostly the vulnerable population are women and children. So the women children protection is need to incorporate into all the health services we are doing that. And the other thing is we also have to engage with different level of stakeholder, and as many of the civil society organization or community organization are working with the local Thai community to make sure that the local Thai public health or social welfare education, we need to get support from them. So working with the stakeholder or state, non-state actor, these are all important partner we need to work with. And while we are addressing the short term, we also looking at the stability and sustainability of the program. And since our program being focused a lot on the humanitarian, but we have to develop the new strategy for the workforce development. So we have to invest on the health, human resource capacity development and building the partnership, as well as we have to adopt the changing context and more flexibility and building trust among our community. So this is a brief, but thank you for.
Thank you very much. Thank you very much for your excellent presentation. And we know that you have done so much for the indigenous people, for the marginalized people, women and children. And you did an excellent job. I just would like to know that where did you get the funding from? You said that from the humanitarian organization. And what kind of collaboration with the Thai hospital or government in terms of that? Because it's located in Tax province, right?
Yeah.
Yeah.
So firstly, under the Thai national program, we can access vaccine from local Thai government hospital. So vaccine we receive, we can provide Burmese migrant children, as well as during the COVID time, we access some vaccine to give vaccine for the cross-border population. So the referral system, also we can provide primary level care, but access to the referral system is very important. So working with the local Thai government hospital, our pregnant women or people who require advanced level care can access to Thai government hospital. And the third one is, while we are working with the school health promotion is very important factor for health promotion in the community or at home. So the local Thai government hospital department and the education department also working with the different NGO to improve school health activity in the school, like school health assessment or mental health, psychosocial support for children.
Thank you very much. No wonder why she got the Max Sai Award. Okay, so please give a big hand. Do you have any question from audience? No? Okay. So maybe we can come back for the Q&A later on. Okay. So next speaker, because time is running, so I would like to introduce the next speaker, Professor Volanta Mongkol Sibsakul. Please, the floor is yours.
Yeah, thank you. Good afternoon, ladies and gentlemen. Let me first of all, let me thank you all for coming here today, and thank you Nation Building Institute for invitation. Let me introduce myself. I'm Waratha Mongkol Sutakul and come from Faculty of Humanity and Social Science, Thaksin University. Today I feel excited because it's my first time for talking English on stage and for talking English on international conference. Please forgive any mistake. Okay, today I will to answer question one by one. Started first question about community engagement and grassroots initiative contribute to improving wellness outcome. From question, I think the grassroots environment is a tiny motor, but it can also have negative effect on one health. I would like to talk to contribute to improve wellness in community. We need to have a key element such as primary care. I refer to service about healthcare in community, knowledge about healthcare, volunteer, good environment, no pollution in community, suggestion from stakeholder in community, participation, cooperate, food security, neighborhood, and law of leader. All of this is important to wellness being in community. I would like to share a case study in Jana district, Songkhla province. The government has a policy for developing the progressive industry model city of the special economic zone, Jana. From the policy, the people in community have a concern about health problem from water pollution and air pollution, a concern physical environment problem and occupation disease. The people in community had some objections to government plan. The people in community anti-policy. From situation, we will be able to approach the action. At the grassroots level, this intent may appear to be little process, yet they have the power to encourage community member good health. Last question. What are some successful examples of community-based intervention that have as that wellness disparity in diverse population? I would like to share case study in Umpang district. Umpang district live in the border Myanmar and Thailand, far from Bangkok and far from Tak province. The Umpang district have a problem before Umpang district was having problem keeping a patient condition under control because the hospital has given the patient medication, but the patient has not been taking it as directed. The problem comes from some people not speak Thai because some people that lack identity card. This problem result into the miscommunication leads to misunderstanding when a patient go to hospital. From problem, the hospital have create a novel method of giving out medication to patients. The hospital have make a symbol on the medication packet. Example in the breakfast, make a simple cook a wouldn't be in the lunch, make a simple sun. From using this strategy leads to the discover that villagers take their medication more punctually. I think it's excellent for a service about healthcare. Dr. Warawit Tanti Watanasap, he is a Umpang Hospital director. He said we cannot be termed a perfect public health system if we put the issue of money and law above the issue of the humanity. Last question, how can social support network and community resources be leveraged to promote wellness and resilience? From question, I think the family oriented it will be the first coordinate. The family can offering guidance on illness prevention or transporting us to the doctor when we ill. And network in the form of neighbor. If we have a good neighbor, we was over one other and inquire about each other. We will in when we need. They also offer assistance and guidance. So network in the form of the co-working. I think if we have a co-working good, network will advocate for and offer its member access to quality healthcare. And social network. It will be very helpful if we apply online society to health system management in the way like initial guidance following up on the initial sample. We might not even need to dive far in order to well 5 to 10 minutes to see a doctor. We can use social. And last question. What role do social determinants of health? And as a will be discussion. I talk to education. Education does not imply as one coursework or graduation from top university, but I refer to a foundation education that will provide information and insight for individuals in that culture for to guide team self and society forward while maintaining good health. And housing, I think some live in the remote location distant from hospital, making it convenient to travel for care. And employment, I would like to talk to group of employment. First group, a legal employment system. The group will not hesitate to take team self for treatment and will not they won't need to worry about money even if they take a break for medical attention because they have an insurance comprehensive. And last group, informal employment. When this group become unwell, this group have a very agreed deal to about section treatment because should they quit, they will lose income, no work, no income. And last question, the challenger and opportunity. Challenger community constantly shifting about mobility, population movement, follow family, public health system. The public health system must get ready to handle the rise in early healthcare that is coming soon due to the combination of the opposite birth rate and age society, emergency of novel illness. We have experience in the COVID-19. We are unsure if such epidemics will occur in the future, and different among people in the society have a gender gender different, age different, religion different, culture different, and linguistic different. This variety of which make it difficult to guarantee everyone have the equitable. And lack of essential resource, lack of money, lack of faculty, lack of medical supply and skill, healthcare work, and problem good government government uncertainty and corruption can make health projects less effective than they were meant to be. And we have an opportunity by Ministry of Public Health this policy for promotion and promotion in community in healthcare in community. Like universal coverage scheme and have a policy royal initiative project and other. Okay. Okay, for me, that's bring the presentation to the end. Thank you for your attention. Thank you.
Give a big hand. So thank you very much for your excellent presentation. So do you have any question from the audience before? Not yet. So he already give the good example from Pang and Jana, okay, initiative, and also mentioned so many resourceful information for all of us. So even though he also mentioned about the changing of the health system in order to respond to the aging community. So now I would like to invite Timothy, who would like to mention focusing on the aging issue. Please.
สวัสดีครับทุกท่านครับ Dr. Kingsak, thank you very much for the invitation, and I'd like to thank ICGW for inviting me to speak here today, and I welcome all the delegates. So I'm the CEO of the former CEO of Jin Wellbeing, and currently on the board of directors of Tonbuli Wellbeing Group. And I'm representing Tonbuli Healthcare Group today. And I'm going to talk about community approaches to wellness, but be focused more specifically on Thailand Super Age Society. So first, I'd like to give you an overview of why I'm talking about Thailand's aging population. I think Dr. Kanyalat earlier and Dr. Yangyut also brought up specific instances of Thailand's aging society. I like to say whether it's been a success or it's been a failure. I would also like to note that my esteemed colleague on my left, the Kenya ambassador sent a delegation from Kenya earlier in the year to Jin Wellbeing to see. And we've had many delegations from the Ministry of Health to come see what we're doing in terms of aging lifestyles. Thailand has, many people don't know, Thailand is top 3 in the world in terms of aging societies. It's right up there with Japan. Currently in 2024, 20% of the population is above the age of 65. Many of you may just hear the word aging society, super age society, but do we actually know what it means, what impact it will have on us? Please set again. Okay. So I also bring this slide up. This is the following 2 or 3 slides are coming from a presentation I gave with our Prime Minister up at the Bangkok Post and his first public speaking engagement. One of the things I'll talk about is aging versus longevity. You hear a lot about aging, and today you've heard a lot about longevity. What does it mean? Okay, how do you age well? Because people are living longer. My generation, I put it as 1967 to 2023. The life expectancy of our generation is now 79 years old. Previously, life expectancy was 65. Thailand has a retirement plan at age of 55 for civil servants. From 55 to 79, you're talking about 24 years of living in retirement. What does it mean? A lot of people don't understand. If you go to an aging hospital, what does that mean? An elderly hospital. If you go to a retirement home, if you go to a nursing home, what is the differences? There's a lack of public education in understanding what all of this means. If you look at Thailand's aging demographics, from 1970, the majority of the population was below the age of 30 to 34. Currently, and expected over in 2030, the majority of the population is going to be above the threshold of 34. What does this mean? It means less people in the workforce, less productivity, less people paying taxes. That means you have to pay higher wages for the people that are actually working in the workforce. That's going to lead to inflation. How does that impact the elderly? If you think about the elderly, when they retire, that's the last money they have to live the rest of their life. As they age longer, their money has to stretch longer. What are we doing about it? Mahatma Gandhi came out with a comment that talks about a society should be judged by the way they take care of their elderly or the most in need. If you're living longer with less, it's a recipe for disaster. Okay? So how can the community engagement and grassroots initiatives contribute to improving the wellness outcomes? Education and knowledge. To me, education and knowledge is the most powerful tool we can use to help mitigate the issues they're facing. Why are the elderly so important? Think about this for a minute. They built the world we live in. I'm here because my father and my grandfather and my past generations built the roads we drive on, built the airports we're in, built the trains we travel on. The infrastructure we have today were built on the past generations. How are we treating those past generations? The new generation will take us forward. The past generations got us here. What do we owe them? If we talk about consumer knowledge and information, it's not just YouTube. It's not social media. Currently, the major trend is going to YouTube, going to social feeds, going to TikTok to find out what's the latest exercise, what's the latest project for the elderly. I like forums like this, and I support forums like this because you're actually hearing from specialists talking in the field specifically on things that elderly or people that are interested in wellness can get real information. Direct feedback from consumers or end users is more important than surveys in going to forums and taking up and hearing from third-party companies, consultants telling you what happens. I'm sure Dr. Cynthia could tell you a lot of experience of what actually happens in her clinics on the border. You can read a book, you can see a survey, you can see a news article, but until you go and you smell, you walk on the ground, you won't know actually what is the actual problems. Understanding the wants and needs of the demographic is most important. So I challenge everybody in this room to look at the next point I'm making. Who are the stakeholders? I see people from the elderly all the way down to the younger generations in this room. You are all stakeholders. The elderly, their relatives, I'm sure some of you that are younger have relatives that are aging. Their friends, their peers, and the healthcare providers. They are all stakeholders in this. So now it comes back directly to me, Jin Wellbeing County. So THG created Jin Wellbeing and Tonbri Wellbeing to take and look after the elderly. We're an activity-based living facility. It's all based on the activities and a healthy, active lifestyle. I'll concentrate on physical and mental wellness. We have to differentiate between the two. There's active living and positive contribution to the community. That's what the elderly would like. They don't want to be put out the pasture. They don't want in their last cycle of life be left to do nothing. Otherwise, depression and isolation happens. Several times in this presentation, I'll talk about the COVID lockdown. We all remember the COVID lockdown. When you were locked down for only a month, we already had psychological problems. Think of the elderly that have been put in facilities or put in their bedrooms for years, the last 10 to 15 years of their life. Is that the way you would like to live your end stage? Provincial versus urban, we see it in Japan, we see it in Thailand now. If you go to the actual grassroots villages in Thailand, you'll see provincial versus urbanization. What does that mean? It means youth searching for education and work in the urban centers. Once they leave their villages, the demographics of the village change. In Japan, there are some villages that are decimated. They can no longer survive. and the houses go abandoned. I see that in Thailand now in the grassroots. As people move to the cities to find work, to find education, they don't return to the villages. The villages become aged. What are we doing about that? The social welfare ministry and provincial administrations are holding clinics, they're holding grassroots elderly programs to try to mitigate this issue. But us as a society, what are we doing about it? Again, I talk about aging versus longevity. Here's another point to bring to your attention. Right now, I classify it as multi-generational care. You have 90-year-old parents looking after their 70-year-old son. You have 50, 65-year-old children looking after their 70 to 90-year-old parents. In Jin Wellbeing, we have a mother and a daughter, 90 years old and 70 years old. They're pushing each other around in the wheelchair. They're doing activities together. How are we and what are we doing to prepare this next generation for this multi-generational aging issue? Have you planned to retire and be able to live the next 20 to 30 years of your life? Do you have the finances? Are you eating the right foods? Are you taking care of your body, your range of motion? It's a lot of things to consider that you have to be around for another 20 to 30 years. Today's generation is a 3-stage life cycle. 20 years in education, 40 years in the workforce, and you're going to need another 20 to 30 years in retirement. These are all things that you need to consider now. When we talk about social support networks, community resources, indirect, elderly share a bond. They share the same mentality. They share the same experiences. They share common concerns. One of the things I'm sad when I watch, I see some elderly care, 70-year-old couple. One's bedridden and the other one is using a walker, and they're taking care of each other. What happens when one of them passes away? They've lived together for 50 years. Their relationship is now codependent upon each other, and one of the loved ones passes away. If they don't have a strong social support network, depression, isolation. Okay, these are all the things that we're not talking about, and I think we should, because that's talking about mental and physical wellness again. Okay, what are the challenges and opportunities? My esteemed colleagues up here have talked about many of the points. My first point is it all comes down to dollars. I'm sure both of you will also agree with me. It's about resources and dollars. Okay, do we have the budgets? Do we have the available resources? Are they being put, the money, the time, the effort, in the right places? Do we actually understand where are the needs? I like to call the elderly the forgotten ones, which is very sad. I always see the next generation coming up when they have a new child. They go to all the schools. They're so excited about putting their kids into schools. Best facilities, the best social groups. They want the best activities. Do we love our children more than we love our parents? Because if you turn around and you think about it, a proper elderly facility is the same thing as a proper school. It's built about social network groups. It's built about activities. It's built about educating the elderly. There's day programs and there's actually active elderly living. Why aren't we talking about these? We see the excitement for the new generation going to school. We see absolutely no support, no government public relations, no education about elderly facilities. I find it sad. You can talk about safety versus constriction. Just like in the COVID lockdowns, before I knew about this, my grandfather was put in his bedroom. Didn't want him to go to the shopping malls, didn't want him to be out and active because we were afraid he would have an accident when he left. We put them in COVID lockdown for the last 5 to 10 years of their life. Think of another thing. Would any of you in this environment hire a 50-year-old over a 30-year-old? I say this because a lot of people, once they hit their 50s, they don't have a choice on their career. The 30-year-old is starting out. But if we're living to 80 years old now, 50 years old is actually midlife. What are we doing to our society by repressing these people? Okay? The opportunities, I would say, elderly tax benefits, tax deductible donation programs for the elderly and elderly programs, volunteer drives, two-way. Ask schools to volunteer their time to go to the elderly facilities. Ask the elderly who are still viable, who have a lifetime experience, to go down to the schools and actually teach their lifelong experiences to the next generation. Public awareness campaigns, public education on what actually is an elderly facility. Let's talk about incentives for companies to hire 50-year-olds and plus. Okay, not decentivize them. Decentivization, I mean, if you hire a 58-year-old and they retire at 60, the company has to pay them their retirement, even though they only worked at the company for 2 years. Hence, companies don't want to hire the elderly. We're de-incentivizing them. People over 60 can't get bank loans. If they can't get bank loans and they want to move into a house, how do they buy a house? How do they live? Night school for retraining the elderly, not just giving knowledge and the new training to the next generation. As an example, social media marketing, selling online. Can't we re-educate the elderly in how to actually do that and they can work from home? So I'm coming to the end of my presentation and I'll just say, as discussed previously, the unprepared, uneducated, and underfunded elderly preparations in Thailand is shocking and saddening. The lack of government incentives in the private sector is also lacking and shocking. Lack of government policies in financial institutions, healthcare and insurance programs are unacceptable, and I don't even understand why there's not. The lack of understanding in end-of-life care and Thailand's healthcare system is ancient. It's borderline barbaric. What I mean for that, I think a lot of us will see, as you get elderly in a government hospital, they need the beds. In your end-of-life stage, they'll send you to go pass away at home. Are the home caretakers educated enough, and do they understand how to take care of an end-of-life stage loved one? I don't think we're there. We're not able to give IVs, pain medications, at home. If the patient takes a downturn, you have to send them by ambulance back to the hospital. People say I send them to the nursing home. A nursing home in Thailand is not able to give IVs or medical care to a patient. You need an elderly hospital for that. An elderly hospital doesn't accept insurance because it's a specialty hospital. We have real problems, real policies that need to be changed. The lack of understanding in Thailand in terms of elderly is very sad. I leave you with Albert Einstein. In the midst of every crisis lies great opportunity. With forums like this, I feel a little bit more comfortable that the message and the knowledge on the elderly can get out and reach further people, and that actually we can actually put wellness in the hearts and minds of the next generation to look after the elderly. Thank you.
Thank you very much. Thank you very much for your excellent presentation and very inspiring. You know what? I'm happy to hear that you care about it and also give a lot of provoke question in our mind that do we really want to invest for our elderly people? Do we really would like to take more care about our elderly people? So this information will be very useful for us to think about it. Thank you very much. And I also hope that Dr. Sompong will also take your message to the Thailand policy. Thank you for this information. And this is a Thailand context. Okay. Now we would like to move to another very interesting context from His Excellency Kiptines Lensi Wimho from Kenya, Ambassador of Kenya of Thailand.
Thank you, moderator. A very good evening to everyone. Let's wave at each other. You have been sitting for too long. Let me start by asking my good friend a question about the elderly. And I want to thank him for fighting for the elderly. Most of his presentation has been on taking care of our aging parents. My mom is 99 years old. 99. And she can still walk without any aid. Because we made a decision as a family to take care of her. My dad died when I was 12 years. So we have been with our mom for the last 50 years after the death of her husband. Let's take care of our elderly parents because they are a blessing to each one of us. You are where you are because they put in a lot of effort and commitment. So thank you for fighting for them. Now, the goodness of being the last speaker is you have nothing to say because everyone has said something. So I won't have much to say. Number one, because most of the issues have been spoken very well by the hummingbirds in front of us here. Professor Princeton, did I say your name correctly? Almost. Thank you for the invitation, and thank you for ambushing me. Let me speak something about partnerships in empowering our communities and our individuals. One of the earlier speakers said that you cannot do this thing alone. Even if you use all the money to keep yourself healthy, what about those people around you? Do you want to be the only one living on planet Earth? You need to share, right? So we are talking about sharing of resources. Those who have been privileged enough to have these resources should be able to share with their neighbor, to be able to share with the others, so that we have a community that supports one another, a community that is healthy. It would be pointless for you to be healthy alone, to be well alone, when your neighbors are dying. So, what is the importance of partnerships in empowering our communities to ensure that they live a long life in wellness, in health? I will share with you my experience with COVID-19, how we worked with the civil society, how we worked with the private sector and the government to deal with the COVID-19 problem. Following the eruption of COVID-19 in Kenya on 12th of March 2020, the government was in a crisis. Everyone was scared of COVID-19. We didn't know what to do. It is the first time that we were facing a health crisis of that magnitude. So we came together, and I was given the task of coordinating international partnerships on behalf of the government of Kenya when I was director for Asia Pacific Department in the Ministry of Foreign Affairs. And I became the coordinator by accident because this thing called COVID-19 started in China. China was in my department. So one morning, the Minister for Foreign Affairs called me and said, "Tell me this thing called COVID-19. And I gave her a small brief. After that, she said, "You are going to coordinate our international partnerships to fight this disease, this pandemic." So what did I do? I started writing letters, started calling our ambassadors out there to reach out to our partners around the world. I remember writing about 210 letters to different countries, seeking for support, facilitating our doctors to speak with doctors from other countries, including Thailand, Korea, Japan, the US, Italy, UK, Australia, everywhere, as the pandemic spread around the world, taking everyone, especially our elderly. At the end of the COVID-19 situation, we had raised resources, we had raised money, we had ensured that the impact of COVID-19 was minimized in our country. So we called in the private sector. They came with resources. We called in the civil society, the NGOs. Everyone came on board. And we established something called the National COVID-19 Response Committee. Everyone was on board. Religious leaders from the Muslim community and from the Christian community. We all came together and sat down, put our minds together and said, what are we going to do? We were able to raise resources. We went beyond Kenya in dealing with COVID-19 and formed a peer committee of African presidents. The African Union set up a COVID-19 committee. And I remember our president donating $1 million to that committee. So all the African countries came together and put some money together to buy the various resources we needed for COVID-19. Now come this thing called vaccine, COVID vaccine. Although I have said that we partnered with the rest of the world to minimize the impact of COVID-19, when it came to the vaccine, everyone retreated to their own country. Something emerged in international relations called vaccine nationalism. Vaccine nationalism. Everyone became a nationalist, not internationalist. Nationalist. Let me give an example. Although Thailand did not do this. Thailand became Thailand. Kenya became Kenya. The US became Kenya. It became America first, or Kenya first, or Thailand first. By the time the COVID-19 menace was going down, some countries had excess vaccines that were expiring, while people were dying in Africa. Selfishness. Selfishness. If you are selfish, if we are selfish, we will not empower our communities. If everything you keep it to yourself, you will not empower the community. We made noise. We made a lot of noise. The money we had raised as African countries to buy the vaccines were not there. Because the countries that were producing the vaccines were hoarding them. They were hoarding them. They were keeping them for their people. So despite the fact that we had the money, there was no vaccine to buy. But not all was lost. We still have good people in the planet Earth. We still have human beings in planet Earth. Some countries went out of their way to share their vaccines with us, including Thailand. Thailand shared some vaccines with Kenya. So not all is lost. We still have human beings within our midst who want to empower others to be able to live for another day. Now, let me come back to a little story that I told yesterday evening for those who are not there. Still on empowering the community. Today we are facing a serious global crisis called climate crisis. We are on the precipice. We are on the edge. We are about to go down. Each one of us. No one will be spared. Just like COVID-19 did not spare any of us. Even countries with the best health systems, millions of people died in the US, in Italy, in Germany, in France, in the UK, with the best health systems in the world. Millions died. What happened to the health systems? They just collapsed under the pressure of COVID-19. So what did we do in Kenya? We realized that this is not the first pandemic, neither will it be the last. So we started putting in efforts under that committee, all government, all society committee, to start rebuilding our health systems right to the grassroots to make sure that when another pandemic comes, we are ready. So we still have a standing committee on COVID-19 even today, setting up, empowering the people in the village, empowering people in the urban areas to ensure that we shall be ready for another crisis or another pandemic when it comes. Kenya is one of the countries that is actually pushing, and Thailand as well. I like Thailand because they also go out of their way to speak about some of these issues. We are pushing for the signing of an international treaty on pandemics, so that we remove this thing called pandemic, or rather vaccine nationalism. We must have a treaty that empowers communities to benefit. It gives them a right to benefit from vaccines produced in America or in the UK or elsewhere, so that this vaccine does not belong to anyone. It belongs to all of us. I like one presentation, I think, by Dr. Cynthia. I think it was it you or my colleague here? There is somebody who said that it is not about money. I think we have lost our humanity to wealth, to money. If you are a doctor in this room today, this is what I want to say to the doctors in the room, medical doctors. I hope that your decision to become a medical doctor was a calling, not because you were after money, but a calling to help a fellow human being. So I want to reiterate what that I think he was a doctor who spoke about that. Let's not put money in front of fellow humans. Let us put that money in empowering our communities. Let's go to the grassroots. Let's teach our women. Let's educate. Let us build capacity for them so that when there is a problem, they can deal with it. Let us empower them so that they are independent. Let us give them the fishing rod. Let us give them the fishing rod, not the fish. Because they will just eat the fish, and tomorrow they'll wait on you again for another fish. What should we do? Teach them how to do the fishing so that they can go to the river themselves and get the fish next time you are not there. So let us empower our community using the resources that we have. I want to thank NBI and Professor for putting the community in front. The fact that we are even having such a seminar or a meeting is because he has put the community ahead of other things. And he has spent resources to empower our community. I want to thank doctors like Dr. Cynthia. I was actually I became emotional for what she's doing on the border. Let me end my discussion by just giving you the little story of the hummingbird. Some of you must have read the story of the hummingbird. It's a story from Japan. There was a forest fire, and the animals were about to burn. The forest was going to burn everything in the forest. So the animals called a meeting, and they met in the open to discuss a solution or solutions to the forest fire that was coming. All the animals, from the big animals to the smallest, like the hummingbird. It's a very tiny bird. So they started talking. Everyone was talking, let's do this. What do? We are all going to die. Oh my goodness, this thing will consume us. And the hummingbird decided that talking was enough. What did the hummingbird do? Rush to the river to fetch water. As little as it is, it rushed to the river to bring water with a small beak to try to put out the fire, to save future generations, to save her children, the eggs that were in the nest, which are going to hatch to future birds. And the hummingbird kept telling the elephant and the lion, please, come, let's go to the river. And they were just laughing and saying, what can you do? You are so small. What can you do with this to deal with this huge fire? At the end of the day, what lessons are we learning from the story of the hummingbird? As little as it is, it made an effort. It made an effort, courageous and committed. The bird didn't just sit there and wait to die. He went to the river. No one is little. No one is small. As long as you have made an effort, you have committed yourself, and the little resources that you have to save our planet, to save our community, then you are not small. You are big within your capacities. Never belittle yourself. Never look at yourself and say, I have a small beak. I cannot do anything. That beak can do something. Don't just sit there. Some of us are elephants. And we are just sitting with our long trunk, with our resources. We are just sitting as big as you are instead of doing something. So my challenge to all of us in this room today, let us be the little hummingbird. Do something to empower the community where you are. Start from your own family, go to the neighbors, and then to the larger community, and gradually to the nation and to the world. We can change this world when we have 1.2 billion or 4 billion hummingbirds. We will save our planet from the climate crisis, from the health crisis. Thank you very much for this opportunity to speak.
Thank you very much for your very inspiring speech, actually. So thank you so much. And you also mentioned so much about why we should commit it and put effort and courageous in order to move something on, move the world to be wellness and healthy. So thank you very much. Okay. So we have no time. Unfortunately, we have no time for Q&A. So if you have any question, you can just send the email directly to the speaker so that you are willing to answer through the mail, right? Okay. Thank you very much. I would like to let all the audience give a big hand for all the speaker once again. Thank you.
Thank you all the panelists and moderators.
Thank you so much.
May I please invite Professor Dr. Kyungsak Jalanwongsak onto the stage to present the mementos of appreciations, starting with Dr. Cynthia Mong.
Before I give the memento, let me just say that I really totally inspired by all of you for what you have to say. And therefore, thank you so very much. And it happened to be that we have decided as a committee that next year, the pertinent issue that we're going to deal with in the ICNB next year, 2025, would be the issue of the aging population, the aging world. Therefore, I'm thinking of people who believe in respectful of the aging people to come along. And therefore, I'm booking you to come and inspire. And I hope that your government will not take you back. Stay around till I let you go. Thank you very much.